Hi, my name is Corrine Harrison, and according to our medical records here, we have a client by the name of Millie Larson who is required 500 milliliters of 0.9% of sodium chloride to be infused at 125 milliliters per hour. It also states that the drop factor of the primary tubing that we're going to use is 10 drops per milliliter to be infused now, which the time is 10 p.m. So I also note that she has no known drug allergies. So with that being said, we're going to go ahead and do the math. So 10 drops for every 1 milliliter. And we have 500 milliliters to be infused. And 125 into 500 is 4. So that will infuse over a period of 4 hours. And every 1 hour has 60 minutes in it. So using this formula, we're going to get our drops per minute. So 10 drops times 500 milliliters times 1 hour is equal to 5,000. And then on the flip side, we have 1 milliliter times 4 hours times 60 minutes is equal to 240. So 240 goes into 5,000, a total of 20.8 with 3 to the infinity. So we're going to round that to 21, which means we're going to have 21 drops per minute. So we're going to provide ourselves with some hand hygiene. And then we're going to gather our supplies. Okay, we have our gloves here. We have our tape and alcohol wipes. We have our common infusion with the expiration date of June 24th, 2024. We also have our bag of solution. Let's refer back to the MAR. We have 500 milliliters, 0.9%, 0.9% sodium chloride for infusion, sodium chloride, and that's to be infused now. The expiration date listed on this bag of solution is September 2022. So we're going to go ahead and check this back for any impurities, and the solution is clear, no sediment, no crystallizations. Everything looks in order. And again, going back to the MAR, we're just going to verify 0.9%, 0.9% sodium chloride for infusion, sodium chloride, 500 milliliters, 500 milliliters. And again, just to be for certain, we have 500 milliliters of 0.9%, 0.9% sodium chloride, to be infused at 125 milliliters per hour with the drop factor of 10 drops per milliliter, which gives us, with the drop rate at 10 drops per milliliter, of 21 drops per minute, which is what we are going to go by. Now we're going to provide Millie with some privacy by pulling back the curtain, and I'm going to provide some hand hygiene. Millie, can I just check your ID band? Yes, okay. I'm going to refer back to her medical records. Her name is Millie Larson. Her ID band states Millie Larson. Her date of birth is 1/1/1936. Date of birth is 1/1/1936, with the medical record stating her number is 123456. Medical record number 123456, with no known allergies. No known allergies is listed. And again, we are to infuse sodium chloride, 0.9%. Sodium chloride, 0.9% to infuse at 125 milliliters per hour, or 21 drops per minute. So now that we have all of that in order, we are going to go ahead and open up our tubing and start to prime everything. Okay, we're going to make sure that the clamp and the roller clamp is closed. We're going to gather the top and bottom of this tubing. We're going to remove the covering from the IV bag, keeping it upside down. We're going to remove the covering from the spike. I'm going to place the spike into there without touching either. And we're going to hang our bag. Now we are going to open our clamp and invert our tubing. Squeeze until we get our drip chamber with half of the fluid, or fill half of the drip chamber. Using the roller clamp, we're going to control the priming. And I'm going to go ahead and make sure that there are no air bubbles as we go ahead and prime our line. Okay, once it's primed, we're going to go back and close all of these clamps to not waste any of the solution that our client is to receive. So leaving the cover on and the clamps closed, we're going to hang that there. And now we are going to go ahead and label our tubing with the date, 5/15/2022. The time is 10 p.m. and my initials. We're also going to get this. Okay, we're going to write the patient's name, Millie Larson. The date, the time up is 10 p.m. So again, if she used to have 125 milliliters per hour and the total amount is 500 milliliters, it is to be down after 4 hours, which brings us to 2 a.m. So we're going to place that information there, as well as 125 milliliters per hour and my initials. And we are going to label the bag with that information for easy access. Okay, once we have labeled the bag, we're going to go ahead and perform hand hygiene. I'm going to place gloves on, and we're going to assess Millie's IV site. Millie, do you have any pain here? No. So the insertion site is without coolness to touch, without pain, without swelling, no edema, no redness. And her clamp is also closed. So now that we got it looks kosher to use, we're going to take the top off of the IV tubing and get that ready. We're going to scrub the hub. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we are going to connect the two. Making sure there are no lines or kinks in the tubing. We're going to go ahead and open the clamp. Open this clamp. Now we're going to use the roller clamp to assure that we have (21) drops per minute. And we're going to do that by controlling this roller clamp. So we're going to start with 21 drops, counting, starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 21. Okay, so now that that's done, I'm going to perform hand hygiene again. And then we are going to reassess the IV site to make sure that there's been no changes and that Millie is going to be able to tolerate this infusion without any distress. Millie, do you have any pain here? No, there's no coolness to touch, no redness, no swelling or edema, no drainage. So now we are going to take our gloves off. More hand hygiene, and now I'm ready to document.